Well, I couldn't think of anybody better to talk about World Heart Day than you, Mackenzie. First of all, just tell us your amazing heart and heart transplant story that you have.
Yeah, thank you. So when I was 8 years old, I was diagnosed with an irregular heart rhythm. And eventually that disease kept progressing and progressing until when I was 17 years old, I had a heart transplant. So this year, I'm really happy to be celebrating the 11-year anniversary of my heart transplant. And I'm doing really well. And everything that experience taught me and that I learned along the way and all the time I spent in hospitals really motivated me to start a career in the healthcare industry. So I went on to pursue a degree in biomedical engineering.
That's amazing. So how cool is it now to go through that story and then to be helping people that may be going through the same kind of stuff that you went through?
It is incredibly fulfilling to now be working at Abbott in the cardiovascular space where I can use my experience as a patient and as someone who's been through the hospital and been through some of these procedures, but apply it from the device design and clinical testing perspective. I think that it really opens up, my mind to those experiences, and sharing my story, I think, helps my coworkers think about everything from the patient-centric perspective as well.
So with your job at Abbott, what exactly, for someone that doesn't know, what does a biomedical engineer do?
Yeah, so with my degree in biomedical engineering, my work at Abbott is as a field clinical specialist in our vascular business. So what that means is that I have the really cool opportunity to travel all across the country to help support our clinical trials. So day to day, that means that I'm meeting with physicians and training them on these new up and coming cardiovascular products. I have the opportunity to follow up with patients that are enrolled in our clinical trials and just help the team at Abbott design these better medical devices for cardiovascular diseases.
So, go back to kind of where it all started. Who would you ever have thought, with all the challenges you went through, that you would now be doing this for a living where you could help other people like this?
I think that younger me would be really proud of where I'm at today. It was actually through conversations with my own doctors as a young teenager during all the time I spent in a hospital that I even learned about biomedical engineering in the first place. I knew from a young age that I wanted to get into healthcare, but it was through those discussions and sharing that interest with other people that I even learned about their career paths for a biomedical engineer.
So you mentioned that, and now that you're in that STEM-related field, so there are so many different careers, but we don't have many women that do a lot of the jobs like you do. How important is it for you to get your story out to help kind of promote the job that you do and the opportunity that women can have to do it?
Yeah, it can be very intimidating, especially as a young woman, to get into a field that is so male dominated. And that's one of my key drivers for wanting to get out there and share my story, because I think it's valuable for young people to see someone that they can relate to in the field. So as a woman in a STEM career, I like to encourage other people to reach out and ask questions and encourage other young women to find mentors and find people that are in jobs that you admire so that you can learn more about what that pathway looks like.
So it sounds like you're very, very interested in what you do. So if you had a little girl that was interested in math and science, what would you say to that little girl right now of what opportunities are out there for her?
I have nothing but encouragement. I like to think of myself as a cheerleader for young women that might be interested in a STEM career, because I really do think that those cheerleaders and mentors that I found, I wouldn't have pursued the career without them. So I think that's a key to my success. I also think that it's important for young people to feel encouraged and confident enough to ask questions and learn about how things work. I think that there are little bits of science and mathematics in everyday things, whether it's how your plumbing or your light works to how airplanes stay in the sky. So I encourage young people to keep that curiosity and ask those questions and find those answers to kind of gain that interest in STEM.
So September 27th, World Heart Day. How important is that to you to get that kind of to celebrate this day, get the information out about it really with your story and the job that you do now?
It's incredibly important and very personal to me to share the news of World Heart Day and share all the great work that I'm doing with Abbott for cardiovascular disease. I think that letting people know about the impact of cardiovascular disease and spreading awareness for how it impacts people is really key to part of my mission, because I think through that awareness, we can build the community in order to help others with cardiovascular diseases.
So you are look to be a healthy, happy 28-year-old. I mean, amazing to have a heart transplant at 17. How are you feeling now?
Yeah.
How's life been since the transplant?
I'm really fortunate to have been celebrating 11 years with this heart transplant with very little complications. I've been able to travel to just about 20 different countries in that time. I was able to go away to a new state and get a bachelor's degree in biomedical engineering and move to a new state to start my career. So a lot of opportunities and experiences that I wouldn't have had without the organ donor.
That's just an amazing story in general. And I know for a lot of people in science, they aren't one of those get out in front of the camera people. So I appreciate you stepping out, putting your story out, and hopefully inspiring a lot of kids to hopefully, go into a field like this. But again, congratulations. I'm so proud that you're happy and healthy and working in a job you love. And again, thank you for taking some time to visit with us.
Thank you so much for having me.